Hello and welcome to this rather different edition of N2Women, which in fact is only possible thanks to your and your predecessors' research in the wider area of internet and communication networks. My name is Toktam and I'm the Director of Center for Telecommunications Research at King's College London. In the next 10 minutes or so, I would like to talk a little bit about some of our research in the area of medical diagnosis and intervention over mobile and wireless network. And in fact, understanding a little bit how mobile network can come in support of health and care. When we talk about mobile health, the first image that comes to mind is the image of wearable devices or various mobile applications that monitor our health passively or are used for fitness purposes. For example, many of us use various apps for fitness. Our research goal was to step further and beyond this point and look into medical grade portable diagnostic devices that could then be remotely operated over mobile and wireless network. There are various examples of these medical devices in different stages of development, and I can give you a couple of examples here. For example, there's an ultrasound device by an Italian startup called Telemed, with which we actually worked during one of our projects. Some of our colleagues at King's are working on a helmet-shaped CT scan device for brain imaging. And a very interesting example that I came across is a wireless stethoscope called EUCRO Pro, which in fact is quite an advanced device and that can be used for various diagnostic purposes. Now, when it comes to medical intervention, in fact, robot-operated surgical theater is a common practice in many areas of medicine, in many areas of surgery, and they are commercially successful products, such as a Da Vinci robot that you can see on this image. So in the intervention area, robotic devices are widely used in the medical practices, and we build and leverage on the existing medical devices that are used. We explore two different routes in our research, either to remotely operate those devices, whether being the diagnostic devices or intervention devices, so no human operator will be available at the remote site, or to send appropriate non-verbal commands and instruction to the human operator of that device who is available at the remote site and is physically operating the device in a way that that device can be operated with little or no expertise of the domain, basically. Now, if we look at the whole ecosystem, assuming we have these portable and robotic type of devices, medical devices, which we have seen there is a quite large portfolio of those. If I tell you I want to operate any medical devices remotely, the first question you would raise is about reliability of that network. So reliability of that network is of a very important, basically, ingredient of the whole ecosystem. And that's where we kick in. That's where we internet or network researchers kick in and start looking into various aspects. And the reliability here refers to reliability of networking delivery of certain amount of bandwidth, a given latency, availability, etc. So it's how reliable we can deliver what is required by the application. Now, when we look at any recipe, there's always lots of ingredients, and I don't think we can get rid of them completely anytime soon in our recipes. So similarly here, we have other ingredients that could in fact come very handy, and one of those are data-driven or AI approaches. In fact, an example that we can use in delivering reliability or network reliability using AI is to fill the gap or cover for all the shortcomings that potentially our network reliability can offer through predictive mechanisms and the use of AI. And so there is quite a bit of element, or there's a lot of room for using data-driven methods and AI in improving the network, or in the route to success for basically building a network that would be appropriate for operation of medical devices over the network. One of our first project in this area that I can share with you is remote operation of a surgical robot, basically. And as you can see here, this is an experimental robot. It's not similar to the fully equipped surgical robot that you could see in the operating theater in an earlier slides. But this is a remotely operated robot which conducts a keyhole surgery. So here, in terms of communication, in one direction, we send instructions to the robot how to move and what additional actions robotic arm are taking, cutting, stitching, etc. And in the other direction, the touch and visual feedback from the environment are sent back to the operator. These touch and visual feedback will be the main guide for the operators, in this case being the surgeon, to then send the next instruction to the robot. So it is really important for this information to be in absolute sync with each other. So timely delivery of this information is very important. There's also a rather huge amount of data which is communicated, because if we want to transmit a high definition visual feedback basically of the environment in a timely manner, that means probably a raw transmission of video data, which requires a lot of bandwidth. So it is quite a demanding communication, basically. It's quite a high demand on the communication link here. And we have the issue of synchronicity between the two sides of communication, which is absolutely important. So this is one of the projects we've been working on for the past couple of years, and we had various bits and pieces of developments in this area. Another work that I would like to share with you is enabling a hospital on the move. In this case, an ambulance that goes to the patient's door and will be the first point of entry of a patient in the hospital. So as the patient steps in the ambulance, it is as if they step in the hospital already. So we focus on using an ultrasound device as a remotely operated diagnostic device in the ambulance. First of all, because it's commonly available. It's a very commonly available device in all the ambulance. Secondly, because it's a type of diagnostic device that its results has to be interpreted online. So while the actual operation, the diagnostic procedure is being operated, then the results should be also interpreted at the same time. So here, a paramedic wears a glove, and through that glove receives instruction of how to move the ultrasound probe. A doctor at the hospital see the ultrasound captured images in real time and send back instruction through a joystick to the paramedic, who then operates and move the ultrasound probe accordingly. Again, if we look into the communication, on one side, we send the ultrasound images. On the other path, we basically transmit instructions to the paramedic. Now, this setup could also have, which in fact it has in the setup that you can see in the images in the video, also audio and video communication between a doctor and the patient in the ambulance to bring more the immersive feeling basically to the patient. If we look into different core elements of the networking technology that provides the reliability in a way that these two projects or these two scenarios are possible, there are various elements that we have played with and we have deployed and implemented in these cases. For example, we have a wide deployment of edge cloud and in fact, dynamic place of these edge computing nodes in a way that both application and network can work in close synchronicity with each other. We also explored the use of intelligence at the edge of the network and very close to the application delivery to cut all the extra bits and pieces of delay. We manipulate data to avoid extra transmission of any data which is not necessary and maintain a very ultra low latency. We use predictive provision of network resources, network and radio resources, basically, to ensure that our transmission line is absolutely ready when data is there to be transmitted, and there is no time spent in the setup and scheduling and so on. And so in the same line of work, we also work on data awareness in scheduling of resources, in particular over wireless medium, which in general, it's a timely procedure. And coming all together, basically, we make it possible to bring down the reliability of the network in a way that such critical operations are possible over network. Now, like any other work, this work had, like, these multiple projects basically have been done in collaboration with various collaborators, but in particular our industry collaborators, Ericsson, BT, Telemed, and guys and St. Thomas's Hospital, who made it really possible for all the work so far to be developed to the stage that they are now. Thank you very much, and I'm so much looking forward to seeing many of you next time in person.